The symptoms and severity of Turner syndrome can vary dramatically from one person to another. Many features of the disorder are nonspecific and others may develop slowly over time or can be subtle. It is important to note that affected individuals may not have all of the symptoms discussed below. Affected individuals should talk to their physician and medical team about their specific case, associated symptoms and overall prognosis. Almost all females with Turner syndrome exhibit growth failure and attain a final height that is shorter than average, short stature. Children may initially display normal growth, usually for the first few years of life. However, in most cases, the growth rate eventually becomes slower than normal and affected children do not experience normal growth spurts, e.g., no growth spurt during puberty. If untreated, the final height in Turner syndrome is often less than 5 feet. Another common feature of Turner syndrome is the failure of the ovaries to develop properly, gonadal dysgenesis. Gonadal dysgenesis can cause the loss of ovarian function early during childhood, premature ovarian failure. Normally, the ovaries produce sex hormones, e.g. estrogen and progesterone, at puberty. These hormones are necessary for the onset of puberty and the proper development of secondary sexual characteristics. Most affected females will require hormone replacement therapy to develop breasts and normal female body contours, undergo proper bone growth, and to begin menstruation. In some cases, affected individuals may begin to undergo breast development and may begin menstruating without therapy, spontaneous pubertal development, but most will stop developing sexually and stop menstruating at some later point during their teenage years. Intelligence is usually normal in females with Turner syndrome. However, affected females may develop learning disabilities, especially difficulties with visual-spatial relationships. An example would be right-left disorientation. Affected individuals may have difficulties with directional sense, learning math, nonverbal memory and attention. Affected females may also experience difficulty in certain social situations. Females with Turner syndrome may develop a variety of distinctive physical features including a short neck with a webbed appearance, a low hairline at the back of the head, low set ears, and narrow fingernails and toenails that are turned upward. A broad chest with widely spaced nipples may occur, which is sometimes referred to as shield chest. Some individuals may have swollen, puffy hands and feet. These symptoms may occur due to lymphedema, a condition affecting the lymphatic system. The lymphatic system is a circulatory network of vessels, ducts and nodes that filter and distribute certain protein-rich fluid, lymph, and blood cells throughout the body. Lymphedema is characterized by swelling due to fluid accumulation, edema, in the affected parts of the body. Additional physical findings may include a receding jaw, retrognathia, crossed eyes, strabismus, lazy eyes, amblyopia, drooping eyelids, and a narrow, high-arched roof of the mouth palate. Some individuals may have skeletal malformations including short bones of the hands, specifically the fourth metacarpals, arms that are turned out at the elbows, and flat feet, pes planus. In approximately 10% of cases, abnormal sideways curvature of the spine, scoliosis, may also occur. Congenital heart defects may be associated with Turner syndrome, especially in individuals with lymphedema. Such defects may include bicuspid aortic valve, in which the aortic valve has 2 flaps, leaflets, instead of 3. The aorta is the main artery of the heart. The aortic valve regulates blood flow from the heart into the aorta. The flaps open and close to allow the passage of blood. Since there are only 2 flaps instead of 3, the aortic valve does not function properly. A bicuspid aortic valve may or may not cause clinically apparent symptoms. Approximately 5 to 10% of individuals may have a congenital heart defect known as coarctation of the aorta, a condition characterized by narrowing of the aorta, which causes the heart to pump harder in order to force blood through constricted area. The condition can be mild and go undiagnosed until adulthood or be more serious, which can be associated with a variety of symptoms including pale skin, irritability, heavy sweating and difficulty breathing. Untreated, severe cases can result in insufficient blood flow to the organs of the body or eventually progress to congestive heart failure. The heart defects associated with some cases of Turner syndrome can increase the risk of severe, life-threatening complications including high blood pressure of the arteries of the lungs, pulmonary hypertension, or aortic dissection, a condition in which there is a tear in the inner wall of the aorta. Blood rushes into the middle layer of the aorta causing the middle and inner layers to separate, dissect. Aortic dissection can potentially cause the outer wall of the aorta to rupture. Kidney, renal abnormalities may occur in some cases including horseshoe kidneys or absence, agenesis, of a kidney. Kidney abnormalities increase the risk of urinary tract infections and high blood pressure, hypertension. Liver abnormalities may include a fatty liver,